So I want to chat a bit about marketing. My name is Blair Primus. I am currently the Vice President of Marketing for SCA Health, formerly known as Surgical Care Affiliates to some of you. We're partners and operators and managers of around 320 outpatient surgery centers across the United States. We've got somewhere in the neighborhood of about 1 million, a little bit over 1 million and change in terms of patients, about 13,000 or so partner physicians, and we have about 12,500 employees. We are part of Optum, and so I have the pleasure of working with some of those teammates as well. And what I wanted to do today was just chat in the spirit of the conversation, chat a little bit about how to start to think about marketing. And the key slide here might be the very first one, which is it's not an expense. Marketing, a lot like Dr. Gerling, a lot like Dr. Spector talked about, is an investment in your time, and you have to make the decision to invest in it. And the good part is that most investments, at least we hope most investments, right, provide a return. And I want to talk to you about how we think our investment in marketing can help you get there. So the first piece to think about is these three things. And in my world, I will tell you that these three terms are the most confused terms, specifically in, in the healthcare setting, are often the most confused terms. What is branding? What is marketing? And what is advertising? And I can tell you that all three of them are actually very, very different. Here's how I like to think about them. A brand is only what other people think it is. How you think about yourself is what we call marketing, and advertising is just simply how you act in public. So as you think about, again, I think Dr. Gerling mentioned it 2 or 3 times, clinical outcomes, quality care, clinical outcomes, quality care, clinical outcomes, quality care. If you do that, that is how others will see you, and that becomes the brand that you represent. Marketing is simply going to be the investment you make to uplift the brand you've already created. Branding is often seen as a logo, or like the slides that I put together, or something that you might use in terms of on your lab coats, or the colors that you have, or your fonts. Those are just elements that make up a brand. But the marketing you put out there, designed to drive patient volume or increase relevance for your brand in the community, is the key piece here. And that can encompass tons of different areas. Of these 3 buckets, interestingly enough, they also go in order of expense. Branding is the least expensive, marketing is middle, and advertising is the most. They all provide different levels of return, but they definitely are the most expensive is at the bottom here. So a way to think about this is to break it down into basic 4 or 5. I'm going to talk through 4 or 5 basic elements, and I think the 2 previous conversations touched on this too. You have to start with content, and the content that you create has to be proprietary and developed and designed by you or yourself, by your team, by your marketing department, by your agency, however it is you create the content. And it sounds like as researchers, you're creating a lot of content already. It's important to think about to a patient or to other partners or consumers in the market. Very simply, why do you do what you do? Why are you good at it? And why is it different or better than anybody else? Those are the 3 outcomes you're going to want from the content that you create. So not just that you perform this type of procedure, but why do you perform this type of procedure? Why are you really good at it? And why is it different or better than anybody else? So not talking specifically about making claims, but I am saying that you can lean on your expertise. You can lean on the research you've done. You can lean on the volume of cases. You can lean on what you've learned and how you've managed. Is there innovation in the space? Are you doing something that no one's doing or has done before? These are the types of pieces of content that you're going to want to develop for yourself. And I really believe these are the foundations of what a marketing plan will look like. So take 1 or 2 areas of your practice and decide how and when you can best create that degree of proprietary content. And as researchers, you're already in a good place to begin this, which is to think about what is it you're learning, how are you applying that learning, and why is the application of that learning going to be better or different than either what they're seeing from somewhere else or someone else. And those are the elements to begin with. So content. So continuing on here, I want to talk about distribution now, kind of a fancy way to think about getting the word out. And I categorize distribution at a foundational level in three ways. You can spend a whole lot of money for it, spend a low amount of money for it, and then there's what I call free 99, which is just simply utilizing owned channels, and I'll talk about that in a minute, to get the word out. So we talked about how important it is to create content and why it really matters. But at the end of the day, if nobody sees it, it doesn't matter that you create it. So the importance is you have to get it out into the world. Social media has been a very popular channel for that over the years, and a very popular methodology for practices to use. That is a relatively low dollar to almost free utilization of distribution. You can pay to actually have your article or your ad or your message placed in something and spend a whole lot of money to get it out there. Television commercials, billboards, things of that nature, very pricey to drive attention to your practice. And what does it mean? Low dollar allows for you to create that content and do it in a way that is with minimal invested, sometimes just the human capital to create it. Free 99 is taking things you already own, your website, a blog, journal opportunities, networking, referral opportunities, meeting with other physicians. Those are ways to showcase and share what makes you take that content you created, what makes it so great, and get it out there. So for creating this content, it's almost as important to think about how to distribute it. So a phrase in my world, which is, content is king, but distribution is the queen that actually runs the family. So the baseline for any kind of marketing plan in today's day and age is going to start with the internet. And there's really four basic components of that, right? A website, and I'm going to use the term website loosely here. It's really just a collection of content and allows for a user to find who you are, what you're all about, and where that's from. It doesn't have to be the greatest website on the planet. It does not have to be super involved or super detailed. It doesn't have to have a ton of cost associated with it. But you do need a place to park all of the content. And then you need to work on the three things that are below this. You need to work on SEO, which is called search engine optimization. And that essentially allows for you to take that content, as you see there, mention the content plan again, take the proprietary content and put it up onto your website so that those that are searching on the internet for it find it based on those keywords. So one way to do that is to start to search for the very things that you think patients are looking for, or what's called a reverse search. What is it you hope patients will find about you, and start searching for it? Whatever results come up there, that's the place you want yours to be, your content to be based on those results. And the way you do that is to then write and create proprietary content that is authored by yourself or co-authored if you write it with somebody else, and place it on the website so that it can be found, and it's called SEO. SEM is the way to pay to do exactly that. So sometimes you'll search for something and see ads. Those ads are the exact same content for the most part, but you're paying to move your listing up above the others. So only think of the difference between SEM and SEO is that SEO is what you generate and costs relatively little that you place on your website, an article about a specific procedure, why you do it the best, why patients should seek you for it. That article pops up on your website. They can find it. The search engine marketing is paying for that, and you're expanding your reach. You can actually pay to have more people find those results. The one on the bottom, and this is newer, not all that new, but in the grand scheme of internet marketing, it's pretty new, last 4 or 5 years, is what's called online reputation management. And this is essentially just reviews and comments and engagement. And this is if you go to your Google listing and you find that you're a 2 out of 5, or your HealthGrades listing and you find that you're a 3 out of 5, you can now, with partners and with a dedicated marketing resource, can actually manage that reputation so that the reviews that are left that are good, make sure that they get more volume of good reviews than you do bad ones. Can't ignore the bad ones, and most platforms don't allow you to eliminate them or delete them or remove them. However, you can push them down the page by asking and inviting patients, partners, to leave good reviews. The best case scenario is when they do it without you asking, but it still can't hurt to sometimes ask. And so there are some sophisticated methodologies and partnerships that you can employ to actually build up your online reputation. And the reason why that's important is because bullet point 4 there actually informs the 3 above it. The better your reputation is online organically, specifically with Google in this particular case, the more likely it is that when people are searching for a piece of content that you have on your website, if Google knows your reviews are good, they'll serve your content over those whose reviews are bad. So they're all kind of related here on the content side. So that's the baseline, or let's say the basics for internet marketing. I'm going to put these in the nice to haves. If you're creating content and you have the ability to actually communicate to patients or partners and you have their email addresses, send them an email once a month and call it a newsletter. Vary the topics, engage in what they want to see, send them an email and ask them what they want to learn about. Is there a new service line you're offering? Is there something more functional that you want to share with them? There's new physician being added to the practice. There's an opportunity for them to learn something new about the way that you do your business. Try to think about doing email marketing and newsletters. At my time at OrthoCarolina, we spent a lot of time on this middle bullet here, which was community integration. This is partnerships and volunteerism and leadership and doing nonprofit work and making sure you're part of your local community. Really figure out where you are locally and spend time having your practice name and the people that represent your practice be a part of that community. If you're associated with cardiovascular practice, you want to be part of the AMA. If you're doing things with orthopedics, you're going to want to make sure you're part of, running, jogging, working out, physical therapy, those types of things. How do you align those pieces together so that it makes sense? The bottom two, more expensive, but very, very nice to have. Creating video, creative and content is paramount nowadays. It is oftentimes optimized by the digital platforms to serve video first. Facebook and Instagram obviously dominate in this area. YouTube clearly dominate in the video space. Expensive to create and oftentimes hard to have multiple versions of because of the time it takes to create it. But having video, either testimonials, introductions, deep dives, what we like to call sort of like a Netflix style content dive into a specific topic. If you could do that and have the time to create it and the capital to do so, highly recommended. And then paying to have social media marketing done. These are actually pushing content out on the social media platforms, Twitter, Facebook, Instagram, LinkedIn. LinkedIn is becoming really, really huge the last 18 to 24 months. It actually exploded during the pandemic. So for those of you not aware, or for those of you that don't spend a whole lot of time on LinkedIn, during the pandemic, it almost quadrupled in audience. And so that size audience has almost fully maintained itself, even coming out of the pandemic. So pay attention to paid social media ads if at all possible. I believe that's it. Content creation, critically important. Thinking about where you host and distribute that content, critically important. And then think of ways to actually use your internet marketing to the best of your ability, and if possible, some of those other channels as we chatted through.